Next speaker is from Dalin City Hospital. It's a very handsome young doctor, Wang Sizan. And the editor is from Kaohsiung. And his story is, the doctor's story is very touching. During the pandemic,
疫情期间的时候，那疫情期间的时候，其实您可以看到，就是也有小朋友染疫。那这时候呢，我们的医护这部分呢，其实就用同理心，你看。给他们呢这样子的一个玩具，然后去陪伴哈，那他们并且呢都是消毒好。那接下来我们就会听到我们今天要即将上线的
Dr. Wang
他怎么去讲，因为他其实是有同理心的哈，所以我们可以看到，就是我们大林慈院在这个部分，让我们来听听施展怎么说。
越大女婴和6岁女童确诊，每个人只想着怎么样帮得上忙。前来支援的医师家里也有2岁女儿，他感同身受。
刚来的时候，因为他10个月大，就想到说他妈妈其实已经分开几天了。因为家里自己也有小孩，就觉得这其实会蛮不舍的这样。那来的时候确实也是活力比较差，看起来他身材是比较偏小的。进去房间之后，看到妈妈看到他的时候，觉得妈妈也快要哭的感觉。
收到惊喜礼物，小朋友一拿到就开心的玩，纯真的笑容让为父为母的心瞬间温暖起来。大新闻嘉义大林综合报道。
所以这件好事呢，当然呢，上人来的行脚到嘉义的时候，一定要让上人知道这一份的温暖，而且。妈妈其实是
感谢慈济医院，有你们的帮忙，才有现在的我们。
4个多月前，当时
好，这则的新闻其实刚刚一样的一个新闻，可是呢，在上人来的时候，施展就有这样的一个机缘去跟上人去分享哈，所以将心比心。那施展其实今天要跟我们去讲的部分，其实是我们现在非常关怀的，而他本身你稍微去Google他一下，他其实是我们迟到的孩子，但是他其实身体上是有病痛在。之前啊，因为这样的疼痛，所以让他投身在这个领域里面多了解，也呢将心比心来解决很多人的一个病痛哈。所以现在我们要透过密语到大林慈济，然后呢一起来遇见我们年轻的医王，我们一起说，我喜欢和你在一起。因为你有正能量，好，师长好，非常感恩师长今天上线哈，来，
师姐好，大家好，
是，
请问听得到声音
吗？可以非常清楚，是
We can hear you very clearly.
清楚吗？
可以
Can you see the
可以全荧幕
PowerPoint?
吗
Yes.
对，麻烦全荧幕。我们看疼痛新解方哈，我相信这一个一定要很多人去让更多人去知道。
We need to
请
make
导播画面
people know more
呈
about
现的画面
this
可以注意一
new
下吗？导
treatments
播，
for aching
现
muscles.
在先 take 主场嘛。好 ，OK， 所以还。是在你并没有出现的，你个人没出现，你出现的是2个都
But
是
the doctor did not appear
啊，对，
in the
我们要
presence.
看帅
Okay,
哥
now
医
we can
生
see
有没有
him
帅
now.？
有哈，
The handsome doctor,
非常
Wang
的感恩
Sizan.
哈。好的，那您可以开始分
And
享
thank you for being here
是
with us.
是，
全球的慈济人，然后商人，大家好，
Hello
还有高雄的
everyone,
师兄师姐，
the
大家好。
master and
好，
all the
我是大
sister
林慈济风湿
brothers
免疫
from
科
the
的王
Kaohsiung.
思赞医师。
I
那
am
虽
a
然没有办法
doctor
到
from
高雄的现场，不过
大林慈济
我
Department
们大林的
of
风湿免
Allergy
疫科其实每个月都收
Immunorheumatologies.
到高雄的师兄师姐
Actually,
的自
every
身医德的
month
关怀，
receive the
也一直非常的感激。
concern from the
那我
Kaohsiung's
今天的
brothers and
话，
sisters.
跟大家分享的是
And today,
痛
I
的
would like to
心
share
结。
with you
如果
a
大
new
家
treatment
没有
for
疼
the
痛的
aching
话，可以
muscles.
10
If
几
you
天
have
的
an
计划
aching
来
muscle,
能
other
做。
than taking painkiller, what else can you do?
那首先呢，我想要分享的是一个
The
实际
first,
的
I would
案
like
例，
to share
他
with
是一
you
个
an
24
actual
岁的
case.
意大
He's
利
a 24 years old
那有一天呢，他
medical
就突然
student,
背痛
and
起
he suddenly
这个
suffered
患
from
者
the
呢，
lower
本身
back
的
pains.
往
And this
胸部跳
patient
跃，而且又是
himself
马
is
拉
a
松的健
tennis
将。
player
一开始
and
当然就
also
是
a
不
long
以为
distance
意，他想
runner.
说只是
At
运
first,
动
he
拉
did
伤，
not care
那
about
当
it.
然
He
只是
saw
休
probably
息几
just
天，然后
muscle
随
strength
着他的
and
状况呢
get
就
some
越来越
rest, it
严
will
重
be
之后，
healed. but the symptom did not change. It's getting worse and worse. As a medical student, he has more medical knowledge than the others, and he started to sense something wrong about it, and he might need to seek for the medical help. Because the patient is practiced in the hospitals, so maybe he doesn't know lots of the people, but he knows lots of the doctors. So when he's seeking for help, all the staff in the hospital all try to help him with all kind of examination and testing and the treatments. And the patient are starting from the internal medicines and orthopedics and rehabilitations, and then taking x-ray and gave him medication. He took his medication. He also did some rest and stopped exercising and did some stretching at home. And the patient applies for all the doctor's order, but the back pain has never changed and even getting worse and worse. Sometimes after a couple hours of sleep at night, he will be awakened by the pain, and he even had to crawl himself to the toilet. And it will take minutes for him to get out of the bed. So finally, during his internship, he needed to use the crutches to get to the hospital. And because he knows lots of the doctor in the hospital, so he even did an MRI check, but we can still find the reason for the illness. 2 years later, from the free movement person into a disabled person. For a 20-something years old young person, it's a great impact for him. It feels like your life is about to start and your body is not. And even seeking for the medical help from the Chinese medicines, even the acupuncture or the chiropractics, and also the full massage, you can tell that he's very desperate. Anything he could try, he already did it. But every night, he still cannot get a good night's sleep because of the pain. Until before graduations, he has a very severe eye inflammations, and he went to the doctors, and the doctors can seem that there's something wrong about it. It's not. It's called uveitis. Means your vision will be blurry. It might be the rheumatology problems. So the doctor suggests him to go to the rheumatologist. Until now, I went to the clinic, and finally, I was diagnosed ankylosing spondylitis. It's kind of an immunosystems problems, and it will affect your eyes and your bones. And the students, you might be able to guess that it's myself. During this process, about a couple of years to find the real cause of the disease. And the process is so torture and painful, but actually it is a great gift from the gods. And this process also did a great impact on me. The first impact is I chose to practice in immunorheumatology. Take good care of yourself in order to take good care of more patients. And because I was been through the disease, I can understand the patient better. Even though when you were actually in there, that you can understand the illness is really out of control and how that feels, and I can really understand that. I know I have been through that when I heard a patient complaining about their pain. I was been through that, and I can understand. And the second impact is back to the my doctors, certain doctors. It was revered by all the other doctors, the famous doctors, like orthopedics, rehabilitations. And after 2 years later, I was finally find out the true reasons. And when I was practicing in the clinic, lots of people has the same experience as me. Like because of their chronic pain, they were wandering around in the departments. They don't know where to seek for the help. And sometimes the doctor will think that you might have a psychological problem. You actually need to see a mental doctors. This is saying when you have a hammer in your hands, the whole world looks like there's only nail left. Just like for the specialists, usually they are very specialized what they are good at, and you have a hammer. But what you can see is only what you are specialized in and ignore the other problems and refer the patient to the other doctors. So when I step into my specialties, it's not enough just to solve your own specialties. Lots of times the pain could be caused by multiple reasons, not just the rheumatisms will cause the pain. It can combine with the other nerve or the tissue that will cause the pain. Okay, a soldier has no right to choose the battlefields, and the doctor cannot choose what kind of disease to treat. So what we can do is to provide the good tool to solve the patient's problems. We don't want to just have hammer. We can have the other tools that can help to solve the problems for the patients. Okay, the following, I would like to tell you some good tools that can solve the aching muscles. The first will be transcaster arterial embolizations. It was in a Japanese doctor himself is radiology, and he discovered it surprisingly when he was doing the operation, vascular embolizations. And through the caster, they can block the cancer cells. So after the therapies, the patient tell him that her frozen shoulder is all healed. And the doctor did some research. Before we saw that the joint pain is, the problem is all about a joint, but some of the pain could be caused by some abnormal capillary vessels. You can see from the pictures, the arrow, those are capillary vessels. They are not the normal vessels. And when you're suffering the pain, this vessel will appears. If you use a microcaster to inject some medicine in there to block the vessels, the pain will be healed without any other medications. And this microcaster is very thin, with a diameter 0.6 millimeters, and is as thin as your hairs. So through this microcasters into the affected area, such as your shoulders or your ankles, and to all the affected area, and we inject some medicine in there, and the medicine will block the problem vessels and can solve the problems, the pain problems. And this arterial infusion treatment can be used on the frozen shoulders or the tennis elbows. As long as you have aching muscles, you can use it. The benefit is the wound is very small, and it won't damage your tissues, and speedy recoveries, and it can last long. and you can back to your normal life right away. And within 1 week, you can feel the difference. Actually, lots of patients, like our volunteers or the long-term workers, when they come to me, their finger already degenerated and deformed, and it is sometimes irreversible, but during the degeneration, it was still swelling and pains, and they took the oral medication, but it's not really helping. And when this oral medication is not functioning well, we will do the nerve hydrodissections, and we can achieve the treatment. And this is the actual operations. Through the finger arterial, we inject the medicines, and the medicine will flow all the way to the abnormal vessels and block it. After a while, the vessel will be extruded, and you can solve the painful problems. And without the medication, the pain could be healed as well. And the second is called nerve hydrodissections. Usually, because the nerve was compresses, they will cause a soreness, hot, and numbness. The most common one is the carpal tunnel syndrome, like mothers or hairdresser or chef, because they overuse their hand. And there's a nerve in the central. It will control your feeling. And when the nerves went through the ankles, it will strengthen. It's just like your neck is strangled. So the nerve become ischemia and hypoxia, and will cause the numbness. The traditional treatment is through the operation to cut open the affected area to decompress the nerve, but the wound is too big and slow recoveries. Lots of patients, they feel hesitated, and oral medication did not function very well either. But now, through the ultrasound, we can inject it around the nerve and decompress it. And the size of the wound is only the size of the pinhole. After the therapy, just press on the wound for 3 minutes. You will come back to your normal life. And this is a real operation during my work. And he himself is a chef. So he was diagnosed as a carpal tunnel syndrome. And through this nerve hydrodissections, we can relieves the nerve compression. And you might feel nervous that I'm looking at the patient while performing the injection but staring at the screen. As you can see, there's a white line in the screen. That is the needle. And right behind the needle, there's a nerve. So through the ultrasound, I can see the real things, and it won't damage the nerve, and you can place the needle precisely next to the nerve, and you can perform the injection. Perform the injection next to the nerve and without damage the tissues, without operation, and you also can achieve a very good effect. And this is Tzu sisters, and she was referred from the other doctor. Herself is a patient from the carpal tunnel syndromes. Last time when you drive to Taichung, drive to Dalin, he just cannot drive well because of her pain was hurting. At first, we don't really know each other. She was referred by the other doctors, and after the treatments, I realized, well, she is my mother's old colleague. There's an old saying that to meet the right doctor is a blessing for the patients. To meet the right doctor is not only the blessing for the patient, it's also the blessing for the doctors. Just like if I did not make the eye doctor refer me, I would still suffer from the back pain and seeking for help. Lots of times, the famous doctor might be the right doctor, but the right doctor might not necessarily to be famous. And during the past years, lots of time, the patient it really takes faith for the patient to meet the right doctors. In Dalin Ciji, we established the sports medicine centers. We also have some patients from the professional baseball team. We cooperate with this professional baseball team. And the right side is from the Weiquan Dragon. They invite our president to be there. And just think about this professional athlete. Actually, they also suffer a lot of pains. They have to take medication before the contacts. So even as people as strong as them, they still suffer from the aching muscles. And through this treatment, we can minimize their pain. Also through the ultrasounds, other than that, we can also inject the hyaluronic acids to smooth the joint. And we can also inject the high-dose glucose or the platelets-rich plasma to help repair the fascia around the bone. We're not only to treat their joints, we have to also treat the ligaments. So we will strengthen the ligament and make those degeneration ligaments can regenerate it and stabilize the bodies. Other than the above method that I mentioned about the TAME hydrodissections, platelet regenerations, besides that, we also have a strong physical therapy team and a sports coach. Because doctor can only find out what's wrong with the patient and treat it, but other than that, it's just not enough because we make the patient pain-free, but the patient did not change their habits to live their life, use the wrong force or the wrong postures. Lots of them, the syndrome will come back again. From the very beginning, they have to learn how to use the proper force and the proper posture from our physical therapists. If the patient have to carry something heavy, and we have to teach them how to posture themselves, how to use the right force. This is what we call prevention is better than cure. We have to prevent it from happening. And when it happens, then we will, through the doctor to perform the injection and through the physical therapist to help them recovery. And also in our centers, we also have this red rope. It's a very special suspension system, but it's actually used to strengthen your core muscles. And when you still feel the aching muscles, because you have to use your from the center muscle, we can strengthen that and we can push the force into around the muscles. So stronger on their heads, we can push the force on the head to toes. And we can use this equipment to strengthen their core muscle and the fascia. And this also is a good tool to help us how to use your muscle, how to use the right force. And this system can awaken your core muscle and straighten your fascia. Just like I said earlier, a specialist could only focus on their specialties and their vision is very limited. But right now we are trying to using other tool to help the patient ease their pains. So we actually need a great team to solve the problems all together. So in our sports medicine, we have neurologists, orthopedics, Chinese medicine, and rehabilitation, physical therapists, and a sports coach. So for your aching muscles, besides taking medication, you can also have other options. So I'm the doctor from the Dalin rheumatology departments. I'm so happy to be here and share my experience with you about the new treatment for the aching muscles. We thank you for Dr. Wang. So what I'm curious about is the is the picture. It's the picture in this. He was taken by the red rose. It seems like it's very difficult, but as you can see in the picture, his waist was supported, and what you need is to use your core muscles to support your own body. So you can really fix it yourself. Anyway, this one looks like amazing. It looks like it's very difficult to do it. And this is a very good system to relieve the pain. And what about your own condition? Are you so we all know that Dr. Wang is totally heals. Sometimes, lots of times, the patient think they also have the ankylosing spondylitis, but the doctor did not think that the patient has that disease. So through the trainings, hopefully I can heal myself. I wish the pain can get away from all of us and we will stay away from the pain and stay healthy. And this is really amazing suspension systems because you were been to that disease. So that's why you can also understand the patient's feeling better. We admire you and we really appreciate you. And thank you for Dr. Lin for coming here. Let's say goodbye to Dr. Lin. Dr. You can still leave a message.